Schizophrenia, understanding a complex reality. Schizophrenia. For many, the word conjures images based on misunderstanding and stigma. Yet, behind the myths lies a complex, chronic brain disorder that profoundly affects how a person thinks, feels, and behaves. It's a condition that impacts not just the individual experiencing it, but their families, friends, and communities. In this exploration, we aim to shed light on schizophrenia, what it is, how it manifests, how it's treated, and critically, to dispel some common misconceptions. Understanding is the first step towards empathy and effective support. What is schizophrenia? At its core, schizophrenia is a serious mental disorder where people interpret reality abnormally. It's characterized by a breakdown in the connection between thought, emotion, and behavior, leading to impaired functioning. It is not a split personality, that's dissociative identity disorder. Instead, the split once referred to a perceived disconnect from reality. What causes schizophrenia? There isn't one single cause, but rather a combination of factors. Research points to a mix of genetics. It tends to run in families. Brain chemistry and structure, imbalances in neurotransmitters like dopamine, or differences in brain development and structure, and environmental factors, such as exposure to viruses or malnutrition before birth, or stressful life events and substance use during adolescence, early adulthood. It's a complex interplay, not a simple cause and effect. What are the symptoms of schizophrenia? Symptoms typically fall into three main categories. Positive symptoms. These are psychotic behaviors not seen in healthy people. They include hallucinations. Seeing, hearing, smelling, tasting, or feeling things that aren't real. Auditory hallucinations, or hearing voices, are common. Delusions, false beliefs not based in reality, e.g., believing they are being persecuted, that external forces control their thoughts, or that they have special powers. Disorganized thinking speech, difficulty organizing thoughts or making connections, leading to rambling or incoherent speech, word salad. Abnormal motor behavior, ranging from childlike silliness to unpredictable agitation, or even catatonia, a state of unresponsiveness. Negative symptoms. These are disruptions to normal emotions and behaviors, often mistaken for laziness or depression. They include flat affect, reduced expression of emotions in facial expression or voice tone. Alogia, reduced speaking. Avolition, lack of motivation or inability to initiate and persist in goal-directed activities. Anhedonia, inability to experience pleasure. Asociality, loss of interest in social interaction. Cognitive symptoms. These affect memory, learning, and understanding information. They can be subtle or severe and include difficulty processing information to make decisions, problems using information immediately after learning it, trouble focusing or paying attention. Symptoms usually emerge in late adolescence or early adulthood. How is schizophrenia diagnosed? There is no single medical test for schizophrenia. Diagnosis is made by a qualified mental health professional, like a psychiatrist, based on a clinical evaluation. This involves observing symptoms, conducting interviews with the individual and sometimes family members, and ruling out other medical or mental health conditions, like substance abuse, bipolar disorder, or brain tumors, that might cause similar symptoms. The diagnosis requires symptoms to be present for at least 6 months, including at least 1 month of active positive symptoms. Is schizophrenia curable? Currently, schizophrenia is not considered curable in the sense that it can be permanently eliminated. However, it is highly treatable and manageable. With consistent treatment and support, many people with schizophrenia can significantly reduce symptoms, prevent relapses, and lead productive and fulfilling lives. The focus is on management and recovery, helping individuals function as well as possible. What treatments are available for schizophrenia? Treatment is typically multifaceted and long-term. The cornerstones include antipsychotic medications. These are the primary treatment, helping to manage symptoms, particularly positive ones like hallucinations and delusions, by affecting brain neurotransmitters. There are different types, and finding the right medication and dosage often requires trial and error. Psychosocial therapies. These help individuals cope with the challenges of the illness. Examples include cognitive behavioral therapy, CBT, helps challenge distorted thoughts. Social skills training improves communication and social interaction skills. Supported employment education helps individuals find and keep jobs or pursue education. Family psychoeducation educates families about the illness and improves communication and coping strategies. Coordinated specialty care, CSC. This is a team-based approach for individuals experiencing their first episode of psychosis, combining medication, therapy, family involvement, and support for education employment. Can substance abuse worsen schizophrenia? Absolutely. Substance use, including alcohol, marijuana, and other drugs, can significantly worsen psychotic symptoms, interfere with the effectiveness of medication, trigger relapses, and complicate treatment. Individuals with schizophrenia have a higher rate of substance use disorders, dual diagnosis, highlighting the need for integrated treatment that addresses both conditions simultaneously. Are people with schizophrenia dangerous? This is one of the most damaging myths. The vast majority of people with schizophrenia are not violent, especially if they are receiving treatment. While severe, untreated symptoms like delusions, e.g., paranoia, can sometimes be associated with aggression, the risk is often exaggerated by media portrayal. Individuals with schizophrenia are far more likely to be victims of violence than perpetrators. Factors like co-occurring substance abuse or personality disorders are stronger predictors of violence in the general population, including those with schizophrenia. Can schizophrenia affect daily life? Yes, schizophrenia can profoundly impact daily life. The combination of positive, negative, and cognitive symptoms can make it difficult to maintain relationships, hold down a job, manage finances, perform daily self-care tasks, and navigate social situations. The illness can lead to significant disability and dependency if not effectively managed. What is the difference between schizophrenia and bipolar disorder? While both are severe mental illnesses that can involve psychosis, they are distinct conditions. Schizophrenia, primarily characterized by persistent psychosis, hallucinations, delusions, disorganized thinking, and often prominent negative symptoms. Mood disturbances can occur but are not the core defining feature. Bipolar disorder, primarily characterized by significant mood swings between periods of elevated mood, mania or hypomania, and periods of depression. Psychosis can occur, but usually only during severe manic or depressive episodes. Can children develop schizophrenia? While rare, yes. Childhood-onset schizophrenia, COS, occurring before age 18, is much rarer than adult onset. Very early onset schizophrenia, VEOS, before age 13 is even rarer. Symptoms in children can be harder to identify and may differ slightly. Less structured delusions, hallucinations, more developmental issues, social withdrawal. Early diagnosis and specialized treatment are crucial. What is the role of caregivers in managing schizophrenia? Caregivers, family, friends play a vital, often challenging, role. They provide emotional support, help with medication adherence, recognize warning signs of relapse, assist with daily living tasks, advocate within the healthcare system, and provide a stable and understanding environment. Supporting caregivers with resources and respite is essential, as the burden can be significant. How does schizophrenia affect life expectancy? Unfortunately, individuals with schizophrenia have a reduced life expectancy compared to the general population. This is primarily due to higher rates of comorbid physical health conditions, like cardiovascular disease, diabetes, and respiratory illnesses, which can be linked to lifestyle factors, side effects of medication, and disparities in access to quality physical health care. There is also an increased risk of suicide. What research is being done on schizophrenia? Active research continues on multiple fronts. Genetics, identifying specific genes involved and understanding their interaction. Neuroscience, using imaging techniques like fMRI to understand brain structure, function, and connectivity differences. Pharmacology, developing new medications with fewer side effects or targeting negative and cognitive symptoms which are less responsive to current drugs. Early intervention, identifying risk factors and developing interventions for individuals at high risk or experiencing initial symptoms. Environmental factors, better understanding the role of stress, cannabis use, and other environmental influences. Where can I find support for schizophrenia? Support is available for both individuals with schizophrenia and their families. Mental health professionals, psychiatrists, psychologists, therapists, social workers. Advocacy and support organizations. Organizations like the National Alliance on Mental Illness, NAMI, Schizophrenia and Psychosis Action Alliance, and others provide education, support groups, and resources. Local mental health services. Community mental health centers offer clinical services and support programs. Schizophrenia is a journey, often challenging, but one where hope, recovery, and meaningful lives are possible with understanding, effective treatment, and unwavering support. As a society, shedding stigma and embracing compassion is crucial in helping those affected manage their condition and thrive.